We have some big news coming in. Government releases results of fourth round of sero-survey done during June-July. 62% positivity through infection, according to the government data. Two-thirds of the population with antibodies. This sero-survey shows that there is ray of hope, but there is no scope of complacency as 40 crore people still are vulnerable. The highest sero-prevalence in vaccinated with 2 doses amongst the adult population. 62% have no vaccine dose. 13% of individuals have both doses of the vaccine. Here's Balram Bhargava speaking on the same. Let's take a listen.
More than half of the children 6 to 17 years were seropositive, and seroprevalence was similar in rural and urban areas, and 85% of the healthcare workers had antibodies against SARS-CoV-2, and 1/10 of the healthcare workers were unvaccinated, that is around 10%. So what are the implications of this sero-survey? So the implications of this large sero-survey done as round number 4 clearly show that there is a ray of hope. But there is no room for complacency. We must maintain COVID-appropriate behavior and community engagement.
Well, let me cut across to Milind joining us. More details on that. Milind, do take us through the details of the fourth sero-survey, details of which has already come out. No time for complacency, but we are coping.
Yes, because the fourth national sero-survey clearly says that about 67.6% of India's population seems to have developed antibodies against the coronavirus, which means that these antibodies were developed by 2 ways. One, through infection, or the number of people who got infected, and the other one says that the number of people who got vaccinated. Since this survey was done during the months of June and just the first week of July. These interim results have been presented by the ICMR, a ray of hope, because the children were also infected, and largely we saw that the children had bypassed the coronavirus infection. They were not severely infected with the virus. That also points out to the fact that children were better able to handle the viral infection of COVID-19. And we know still there are no vaccines for children. So this seems to be a ray of hope in the coming days as well. But on the issue of whether schools can reopen now or not, DG ICMR Balram Bhargav said that schools will have to and states will have to look at it closely, because those districts that have not developed as many antibodies in people are still vulnerable. To put it very simply, Dr. V.K. Paul has also said 1 in every 3 people are still vulnerable to the infection of COVID-19. Which is why vaccination-induced antibodies or immunity are very, very important at this point in time, Nabila. There are a lot of other data that has been shared, but very crucially, the children 6 to 9 years and those till the age of 17 were also as infected with the COVID infection as were the adults. So we're looking at a similar rate of infection, which means that children may have already developed antibodies to fight against any possible third wave that may come.
Right. Milind, thank you very much for joining us with those details.